How many of you have chosen not to go to the doctor? Now, what was your reason for that? Was it going to be too expensive to go? Now, in the United States, our current insurance options are too expensive. It's too expensive for you to go see the doctor for about a sprained ankle, or to get images done or lab work done. And according to Kimberly Amadeo on thebalance.com in the article, What is Universal Healthcare? On June 27th of 2021, the United States is the only one of 33 developed countries that does not have universal healthcare. Now, the U.S. has certain systems in place that are similar to universal healthcare, and those are Medicare, Medicaid, and the Department of Veterans Affairs. Now, these systems provide health insurance to a specific population. I work in a hospital and I see how bad our system is. And I've also done research to further understand what universal healthcare is and how it works. Now, today I'm going to be talking about universal healthcare and why you should want it. According to yourdictionary.com, on July 24th of 2021, universal healthcare is defined as making basic medical, dental, and mental health services available to all members of a society. And today, first I will talk about the 3 different universal healthcare systems. Then I will talk about the overall lower cost of having a universal healthcare system. And then finally, I will talk about the easier access to preventative care and the standardization of care under universal healthcare. Now, in the research that I've done, I've gathered that there are 3 different types of universal healthcare systems. There's the single payer model, the social health insurance model, and the national health insurance model. Now, in the single payer model, healthcare is provided by the government for free, but is paid for by the revenue from the taxes, income taxes that are used to help pay for this. Now, the Department of Veterans Affairs is a system that's in place in the United States that uses this system. And in this system, all services are government-owned and government employees. So everybody who works in healthcare is a government employee. All citizens have the same access to this care. No matter who you are under the system, you have the same access. And the government provides quality care at a reasonable price because they are in control of the prices of the insurance. Now, the United Kingdom, Spain, New Zealand, and Cuba all use this system. The second model is the social health insurance. In this model, everyone is required to buy insurance, and it's usually bought through your employer. And in this model, the taxes from what you paid for goes into a government-run health insurance fund, and it's used to pay for everyone's health insurance. Now, the government also controls the prices in this, and since they control the prices, they set the providers' prices also. Now, the system was developed in Germany, and France, Belgium, the Netherlands, Japan, and Switzerland all use this model. The last model is the national health insurance model. And in this model, public insurance pays for private practice insurance. Now, everyone pays into a national insurance plan. And there's only one insurance company. Since everybody's paying into one plan, there's only one insurance company. And since there's only one insurance company, there's a less administrative cost. And the government also forces the private practice the prices for it. They run the prices. And Canada, Taiwan, South Korea all use this model. The U.S. also has Medicaid, Medicare, and TRICARE all systems in place that use this. Now that we know about the 3 models, I'm going to talk about the overall lower cost of having a universal healthcare system and how that is achieved. Now, the U.S. government would set prices through negotiations. They would negotiate with the insurance company that they're dealing with and set prices. Now, businesses also wouldn't have to offer insurance because everybody's offered insurance already. The hospitals and the doctors that would be working would only be dealing with one agency, so that makes less administrative cost. One whole entity, they don't have to pay for marketing or advertisement because everybody knows about the one insurance company. And according to publiccitizen.org, in the article, Medicare for All would save the U.S. trillions, public options would leave millions uninsured and not garner savings. On February 21st, 2021, A recent study by Yale epidemiologists found that Medicare for All would save around 68,000 lives a year while reducing U.S. healthcare spending by around 13% or $450 billion a year. Now, most families would pay less than they do now for their premiums, their copays, and their deductibles under a Universal Health Care Act. And in that same article, it states that overall working families that make around $60,000 a year would pay up to $14,000 less on their annual health care cost. Now that I've talked about the universal health care and it being cheaper, I'm going to talk about the easier access to preventative care and the standardization of care. Now, preventative care is important. Preventative care helps detect or prevent diseases before they become too serious, where it becomes a massive cost, before it becomes a major deal. Now, annual checkups, immunizations, flu shots, screening and tests are all basic preventative care things. And these are just a few examples. All this would be standard with much more too. Now, preventative care lowers cost. Like I said, if you use preventative care, you're going to help catch a disease or see if you have diabetes sooner before it becomes a major expensive thing. And a lot of people who don't have access to preventative care end up using the emergency room as their primary care physician. Now, according to Peter Forte on tincture.io, in the article called "The Way to Fix the Emergency Room is to Fix Primary Care," on May 16, 2019. In 2016, data from the CDC shows that at a minimum, 41% of 102 million ER visits could have or should have been handled elsewhere. And according to ncbi.gov, in the article "Universal Healthcare in the U.S., a Healthy Debate," on October 30th, 2020, with easier access to preventative care comes less future social cost. The economic strain associated within an unhealthy population is particularly evident among low socioeconomic status individuals. Now, if we had universal health care in place, people would have preventative care that they would take. There would be a smaller gap between the high socioeconomic and the low socioeconomic of health issues. The gap would be smaller. And now that I've told you why you should want universal health care, I'd like to take a few moments to go over my points. First, I talked about universal health care and the three different models. And explaining what I talked about, we talked about the three different models of universal health care. We talked about the overall lower cost of universal health care. And then we talked about the easier access to preventative care and the standardization of care. Now, I've personally not gone to the doctor, and my reasoning was I thought it would be too expensive for what I was going to get and how long I was going to deal with the pain or something. Now, in the long run, I ended up dealing with the pain longer than I should have instead of just going to the doctor. But if universal health care would have been an option, I would have easily gone to the doctor, got it taken care of, and not had to deal with the pain as long. Now, in closing, having universal health care means people have access to health services when they need them, when and where they need them, without financial hardships. Everyone should have access to affordable health care, and universal health care can make this happen. This is your health. If you can't afford to go to the doctor, then you can't afford to not have universal health care.